Hello and welcome back to GP Video Podcast by Nadia. So as you guys know that I have been talking about mental health issues a lot in my video podcasts, and I have touched base upon depression as well and antidepressants. But today I would like to also start another topic which is called anxiety disorders. And I think I've spoken about anxiety disorders before as well, but I would like to now thoroughly go through all the mental health topics, including depression, anxiety disorders, bipolar. I have spoken a lot about PMDD, which is premenstrual dysphoric disorder, but I would like to touch base upon that as well, because I'm sure there are so many of you who haven't watched my earlier video podcasts. So, and mental health is so important, which constitutes around 50 to 60% of our general practice presentation. So it's really very important to talk about these and their medications and their treatments. Okay, so anxiety disorders. Anxiety is an uncomfortable inner feeling of fear or imminent disaster. The criterion is generalized and persistent anxiety or anxious mood, which cannot be associated with or is disproportionately large in response to a specific psychosocial stressor, stimulus, or event. So see, anxiety is a very common reaction. It's a flight and fright reaction to if something happens to you, like if there is any stimulus from the outside, like if you are fearing something, or if there is a death in the family, or if there is an exam coming up, or anything large, big or small, is everybody gets anxious. It's a normal physiological response. But what the definition tells us is that generalized and persistent anxiety or anxious mood, which cannot be associated with either there is no external stimulus, or there is external stimulus, but the anxious mood or anxiety is actually much larger in response to that specific stressor. So that is that, but we'll come back to the anxiety definition a lot more next time as well. But what I would like to tell you today is what are the classifications of anxiety. So number one is generalized anxiety disorder. Number two is panic disorder with or without agoraphobia. Panic disorder with or without agoraphobia. Agoraphobia is the fear of crowded places. Okay. Then we have specific phobias. Then we have social anxiety disorder or phobia. Then we have phobic disorders. Then we have separation anxiety disorder. Then we have obsessive compulsive disorder. Then we have post-traumatic stress disorder, acute stress disorder, adjustment disorder with anxious mood, somatoform disorder, illness anxiety disorder. So many of them, because when we come to the classification, DSM-5 classification system, there are so many of them. But out of them, I would only be addressing the ones that are most commonly seen in the general practice world. Number one is, of course, generalized anxiety disorder. Then number two is obsessive compulsive disorder. Then number three is post-traumatic stress disorder, social anxiety disorder, and panic disorder with or without agoraphobia. These are the ones which are really common. Okay, so when we talk about generalized anxiety disorder, so again I would like to go on the definition, because definitions usually give us a very good picture of what we are looking at. Generalized anxiety comprises excessive anxiety and worry about various life circumstances occurring more days than not for at least 6 months, and is not related to a specific activity. So a generalized and a constant anxious mood for the last 6 months, and which is not related to a specific activity, time or event, such as trauma, obsession or phobias. It is associated with 3 or more of the following symptoms. Number one, restlessness or feeling keyed up or on edge. Number two, being easily fatigued. Number three, difficulty concentrating or mind going blank. Irritability, muscle tension, sleep disturbance. So out of these 6, 3 should be there for the last 6 months. Number one, restlessness or feeling keyed up or on edge. Number two, being easily fatigued. So see, fatigue could be one of the major signs of anxiety. difficulty concentrating or mind going blank, which actually is one of the features of ADHD as well, but see how it comes in generalized anxiety disorder as well. Irritability, which is one of the features of depression, but see how it comes in generalized anxiety disorder as well. Muscle tension and sleep disturbance. Out of these 6, if 3 are present for the last 6 months constantly, then it is classified or diagnosed as generalized anxiety disorder. We have to also, of course, check if it is related to, any physical issues, thyroid issue, any other hormonal issues, everything, any illnesses, everything we have to exclude, and then we have to come to this conclusion. As it says here, what are the important checkpoints? Is this hyperthyroidism? Is this depression? Is this normal anxiety? Is this mild anxiety or simple phobia? Is this moderate or severe anxiety? So basic investigations, thyroid function test, ECG, chest x-ray, and drug screen. Now, in pharmacological treatment, we start with, for acute episodes, we start with diazepam as a single dose or diazepam at night time, which are only used for up to 2 weeks. If we are doing it regularly every day, then for up to 2 weeks. So recommended for up to 2 weeks, then taper off to 0 over next 4 weeks. We do not take them off straight away. We taper them off over next 4 weeks. Consider beta blockers in patients with sympathetic activation such as palpitations, tremor, and excessive sweating. Example, propranolol 10 to 40 milligram 3 times a day. So number 1 is diazepam for 2 weeks, then in acute episodes, then taper them off over the next 4 weeks. Number 2 is if the patient is having physical symptoms like palpitations, tremor, and excessive sweating, we put them on beta blockers, propranolol 10 to 40 milligram 3 times a day. However, they do not relieve the mental symptoms of anxiety. They are only for physical symptoms of anxiety. Then long-term treatment, if non-pharmacological treatment is ineffective, like psychotherapy, counseling and all, for persisting disabling anxiety, the drug of choice are selective serotonin reuptake inhibitors or SSRIs. So diazepam is just for the acute episode. Propranolol can be long-term, but it is for the physical symptoms of anxiety. While for the long-term treatment, we go with SSRIs. Number 1 choice is sertraline. 25 milligram. We start with 25 milligram and we can go up to 200 milligram per day. Then if we go for SSRI, sertraline is our first choice. In SNRI, serotonin, noradrenaline reuptake inhibitors, we go for venlafaxine, controlled release 75 milligram daily, increasing gradually to 225 milligram per day. So sertraline is from 25 to 200, while venlafaxine controlled release is from 75 milligram is the smallest dose, and we go up to 225 milligram per day. Continue for several weeks after symptoms subside and wean off after 6 months. Or the other option in SNRI is duloxetine. We start with 30 milligram daily and then we can go up to 120 milligram per day. So these are the 3 main drugs used. Sertraline, which is an SSRI, and number 2 and number 3 are SNRIs, which are venlafaxine or duloxetine. So either one of them. Whatever is started, we have to check the response for at least taken from anywhere from 6 to 12 weeks and then decide whether it's working or not. And then when it's worked and then the symptoms have subsided, very carefully, if we have to wean them off, they shouldn't, if patients can be on it for a long time, until and unless they are experiencing very serious side effects. Otherwise, they can be on it till we can analyze, okay, now it's been a long time, patient hasn't had any symptoms and patient is willing to come off it, then wean off very gradually over 6 months. Please do not come off your antidepressants and anti-anxiety medications straight away. This is very, very dangerous. Talk to you next time.